Another week, more committee hearings this week, Senator, including one of your measures that relates to pharmacists that's heard this week.
Yes, and this has been a priority bill of mine. I had it last year. We did not get it over the line, but what we do in the Senate is you get to pick your top 3 priorities. And so those bills, leadership really gets referred quickly to committees, then you get your committee hearing pretty quickly, and then they have the opportunity, if they're good policies and get out of committee, that you have the opportunity to get them heard on the floor a lot faster. This bill is a bill that allows our pharmacists to continue what they've been doing for the last few years. Under the Trump administration emergency order, pharmacists were allowed to expand giving vaccines. And so right now, pharmacists can give vaccines with having a connection with a doctor. So the doctor allows that. Well, what you have in a lot of the rural areas is if a pharmacist doesn't have that approval, that contract with the physician, then they're not able to do that service. Well, the executive order from the Trump administration allowed them to do that without that tie in with the doctor. It really helped. We have such a shortage in the healthcare industry right now. We're all hearing about it, of course, with our physicians, with our nurse practitioners, our nurses. And so allowing our pharmacists to continue doing this, they have really stepped up and stood in the gap over the last few years. Well, now that, the emergency orders are going away, I want them to continue to be able to do this. Our pharmacists in our rural communities, oftentimes they're the person that we trust, when it comes to being able to stop in and say, "Hey, I've got this going on. Can you tell me, is there something over the counter that I need?" Or even much more in-depth conversations you have with your pharmacist, and they're so available. And every person in Missouri lives within 5 miles of a pharmacy. That's not the case when it comes to a medical professional, say a nurse or a doctor. And so this is a very important part that our pharmacists have filled in our healthcare system over the past few years. And I want to make it law, whether we're under an emergency order or not. So hopefully we'll get it across the line this year. It was really well received last year, but we just couldn't make it happen.
Big week for committee hearings, especially, and that includes the first hearings of the Senate Appropriations Committee, which you now serve on as well.
Yes, the Approps Committee runs a little bit different than our other committees, and so I had just had a bit of a learning curve. It's been incredibly interesting. We've gone through the governor's budget recommendations, then we moved on to corrections, and so we got through the corrections budget ask. One of the things that was in the corrections budget ask that I really appreciated Director Precythe doing was increasing the services to our staff there in the prison. And it was services like an HR person in each one, services like a mental health specialist and things to be able to help them have an access to someone where they can download. They see a lot, they go through a lot. And one of the things that's been surprising to many is that down in Southeast Missouri, at the corrections facility that we have in Charleston, the pay has not been what I've gotten the most concern about from our workers. It has been the mental health aspect of it. It has been the safety of it and the fact that, they just can't handle it anymore. Their family can't handle it anymore. And so Director Precythe really did a wonderful job with more pay for those swing shifts, for those nighttime workers, and then just allowing more support staff for our staff. And I think that's going to be really helpful when it comes to retaining those employees.
Coming up now after these first couple of weeks of committee hearings where the first legislation presumably could be heard on the floor next week. Does we get a feel for at least how the first part of the session could go in terms of what kind of legislation we see and how quickly things go through?
Yes, next week we absolutely will have some floor debate. We'll kind of see how everyone's gelling together at that point. It's a well-known little tidbit that we didn't gel together very well last year. Much of that was over the redistricting maps. And so now that that's out of the way, I feel like next week we'll really get to start talking through these policy discussions. I'm pretty excited to be on the floor and really get to focusing on things that I enjoy so much about this job, and that's policies that really help move Missouri forward and really help our people.